Well, good evening. My name is Katherine Lee. As introduced, I'm a family medicine physician over at Eastside. Ooh. All right, let's try that again. Is that a little bit better? No. Excellent. Lavelle's going to kind of turn it up as I go. I promise my intro won't be that important. But my name's Katherine Lee. I'm a family medicine physician. I work over at Eastside. I'm delighted to be here speaking at the first Women's Health Expo and hopefully maybe annual. So I thought a lot about what to talk about this evening because family medicine covers so many different topics. The wellness visit, even in and of itself, covers so many topics. And instead, I thought I might just back out a little bit and talk to people about how to make the most of your annual wellness visit. I don't have any relevant financial disclosures, new docs. One of my siblings is a professor, and I always ask, how should I punch up my slides? And they tell me people like pictures of animals and flowers and grandchildren. And so I have flowers for you. And so tonight we'll be talking about what is an annual wellness visit, how should you prepare, and then what to do day of. So there's a lot of names for the annual wellness visit. You may know it as an annual, a physical. We start these in children. So a well child, well woman, well person exam might just be called a preventive visit. And then Medicare has its own type of wellness visit called the Medicare annual wellness exam. But all of these are really just a once a year opportunity to focus on preventive health. There's a lot of different goals to wellness visits, but my main two are one, building a relationship with your primary care doctor. If it's been several years, it's hard to maintain that relationship, but then also work on providing preventive care. And that shows up in a couple of different ways. We work on supporting people's healthy habits, finding any new health risks and opportunities to improve someone's health, and then perform any relevant health screenings. When I talk about health screening, I mean different tools to catch problems early and illnesses early in stages when people don't have any symptoms. So for example, catching early breast cancer with mammograms, catching high blood pressure because high blood pressure oftentimes has no symptoms, things like that. So an annual wellness visit may include a lot of things. The biggest is going to be about healthy habits. I have that as one line up here, but it means oh. How's this? Better? Fabulous. Thanks, everyone. It's okay, I'll cover again what we talked about. So healthy habits, that's very broad. We're talking about healthy eating, exercise, sleep, alcohol use, drug use, avoiding tobacco, things like that. And so we ask questions about that because they're relevant to people's health. We're always talking about relevant vaccines, what's due, what's coming next. A lot of people are familiar with preventive screenings, things like cardiovascular health risks, particularly things like high blood pressure, diabetes, high cholesterol. We talk about preventive screenings for cancers. Bone health is particularly important in women, thinking about any risk for sexually transmitted infections, and screening for mood disorders. We're also using this visit to talk about family planning goals. Is someone wanting to become pregnant and wants support or preparation? Is someone not wanting to and wants help avoiding this? And then, as you might remember, for folks who have kids, when you go to a well child visit, there's a lot of talk of what to expect next. We also try to do that for everyone with annual wellness visits. If someone's a teenager, we're talking about that transition to early adulthood. If someone's in their late 30s, I start talking about a transition to perimenopause or into menopause, just because that can be really helpful information. So as you might guess, there's a lot to cover in this visit. This visit is typically about 20 to 40 minutes. At my clinic, it's 30 minutes. So it's a lot to squeeze in. If I did every single recommended screening, counseling that is recommended by the United States Preventive Services Task Force, which kind of gives me my recommendations, I would have 25 different things to cover during this visit. As you might know from going to your doctor, there's not time to cover 25 things ever. And so it's really important for us to be kind of whittling down what's the most relevant information for you and your health. In general, wellness visits are free. I have a big caveat there. So most insurance will cover an annual wellness visit without cost sharing, meaning no copay, no insurance. That said, there's been a lot of changes in healthcare policies in the last couple of years. And if there's any non-preventive issues that come up, for example, knee pain, trouble breathing, medication refills, oftentimes this can add an additional cost. And so I try to warn my patients when we're kind of heading into territory that this might be outside of the wellness visit. And wellness visits vary by age. What I'm talking about with teenagers varies from the folks I'm talking about with later in life. For teens, I talk a lot about safety, tobacco, buckling their seatbelt, sexual health, things like that, family planning, versus and probably less about bone health and cardiovascular risk, so that's still there. Versus for folks in midlife, as folks are kind of hitting perimenopause, menopause, that is a rich visit. We are covering a lot of things. This cardiovascular risk starts going up, those cancer screenings around age 40, 45, 50, they all start hitting. And I'm still talking to people in that transition about, family planning, STI testing, because sometimes in that transition, folks can still get pregnant. And then I'm also thinking about for my older adults, my big emphasis is on healthy aging. I'm less concerned about what's exactly someone's cholesterol level and just about their overall health and function and how can we protect their health and help them age well. And additionally, we're still thinking about those other risks too. So my first recommendation is to be prepared. Before you do your visit, gather that information, get that family history, talk to your mom, talk to your grandma, get those details. Talk to that sibling that knows everyone's business, and then get the results of your prior preventive screening. When was your last PAP? What was the result? When was your last mammogram? What was the result? A lot of these screenings can be 5 to 10 years. It's hard to remember when they last were, and so it's nice to keep track of those. If there's been a change to your health, good opportunity to request those records and get them sent over. Then I always recommend people have an up-to-date medication list. Also work on making that list of questions and concerns. Couple details with gathering that information. Family history, my number one things I want to hear about are what's called first degree relatives. So parents, siblings, children are my highest priority. If someone's great aunt's best friend had something, I'm less worried, but especially I'd sink your time into making sure you know that initial family history. In particular, I'm thinking about things that modify my patient's risk. So risks of cancer, risks of diabetes, existing cardiovascular health. Does someone's parent have osteoporosis? And then it's helpful to know about what age they were diagnosed. I don't need to know exact age, but a general decade can be really helpful, or kind of premenopause or postmenopause can also be helpful in knowing someone's diagnosis. Like I mentioned before, knowing when your last preventive check was and what those results were, just because it's harder to keep track. I recommend folks would kind of keep these records together. There's a shot that's every 10 years. No one remembers when their last tetanus booster was. And so try to just keep those, keep a stack of those papers, and it's helpful to bring them with or summarize them. So I mentioned bringing a question and concern list, and you might say, but Dr. Lee, this visit sounds way too busy for me to actually bring up questions and concerns. To which I would say, still bring it. It really helps us when you bring that list to tailor that visit to you. For example, someone who's coming to me saying, hey, I want to get pregnant in the next year or two. It kind of pivots me to think about talking about preconception planning versus other topics. Someone might update me about something new in their family history. That now cues me to talk more about that issue. It also, by bringing this list, it helps me identify perhaps reasons to cancel that physical and pivot to a different kind of visit. If people have urgent concerns, if they have chest pain, they have new abdominal pain, they have horrible nausea, let's cancel that physical and talk about the issues that are really on someone's mind that day. We can reschedule a physical. And it helps me get that list and prioritize when to bring people back. So here's an example. So good to see you, Dr. Lee. It's been a crazy year. I wanted to tell you I'm not sleeping, my ankle hurts, I'm always bloated. An ED doc told me my blood pressure was high, and I'm pretty sure I have swimmer's air. Thank goodness I had this annual scheduled. To which I would say, get the physical. You've got other concerns. They're clearly on your mind. They're clearly bothering you. So let's address those. So let's pick 2 or 3, work on those, reschedule your physical. That's okay. We're not mad. We don't care. We'd rather just get you what you need in that day, because we know it's hard to get that appointment. Kind of similarly, like Dr. Lee, good to see you. I noticed a lump in my breast. My blood pressure was high when I checked it at the pharmacy, and my knees have been really achy. Do I need another visit? Can we do this today? And that helps me get that information, because I can easily recheck a blood pressure. I can easily incorporate an exam for a lump in the breast. But that other issue, that deserves a visit on its own to really dig into that and give you a good answer and a good exam, rather than squeezing it in and not having a good plan. So the day is here. Please arrive early. Oftentimes for physicals, there's some paperwork. Depending on the clinic, we do other things beforehand, like vision screenings, hearing screenings. If it's a Medicare annual wellness visit, there's a lot of different steps. So coming early is always the right answer. Bring that information you gathered. Best of all, that's written down. It's hard to remember your family history. It's hard to remember your last pap smear. Write it down, bring it to us. It helps us get it into the computer so we can have that good information for later too. At the top of your visit, let your doc know if you have any big concerns. It's great if you can pick the top 2 and share them, because those top 2 can help me decide, do we need to adjust? Do we need to bring you back? Can we address it today? Bring your questions, and then bring your preferences. Everyone has different preferences for what they need to be most comfortable, whether it's letting me know, hey, can you be on my right side because I have some hearing impairment? Letting me know I'm really worried about that pelvic exam, like it's on my mind when we talk through that at the start of the visit. Totally. I want to know what helps make people more comfortable, and bring that information and share it with us. This is my to-do list. I'm working on just listening your questions and concerns, making the agenda in my head, updating your health history, finding what the health strengths are, finding those areas for improvement, thinking through what those preventive tests that are due, and thinking about what plan best fits you. In that somewhere, I do an exam. I gotta say, it's probably the least exciting thing about a physical. Most of it's just talking. Some relevant exams might be a breast exam or pelvic exam, only if indicated. The Medicare annual wellness has its own kind of special exams. So I always kind of walk people through what that looks like. I'm ordering a bunch of testing, and I'm making a follow-up for when do people need to come back and see me. So I would invite you to work with me for rethinking your physical. Instead, as you can tell, this isn't a set list of labs. It's not a set list of studies. It's not a special physical exam to look for one specific thing. This really is this broad opportunity to update your health history with your doctor and build that relationship, to understand your current health, to identify those strengths and areas to improve, and to tailor those screenings so it best fits your needs. So we talked about what that annual visit is. I want folks to come prepared and arrive early. Let us know how we can best work together. And then we would always love to see you back and continue working together. Thank you so much for your attention.